Let's talk about health freedom. Let's talk about vaccine choice. So first of all, Senate Bill 177 is kind of the top bill that gets focused on. This was very simple. Brian Harrison came up with it as a brainchild. He just said, we're going to end COVID vaccine mandates, period. You can't get fired from your job. You can't get brought in. Anthony Fauci figured out, hey, I'm going to pass government mandates and I'm going to get all these private employers to become my little Nazi enforcers. And they're going to go around and tell everybody, you're not allowed to feed your family if you don't get the vaccine. And these people said, I'm not getting the vaccine. Great, you're fired. This bill would have said you can't do that. Passed out of committee, passed out of the Senate. The House bill and the Senate bill passed out of committee. Stephanie Klick sat on it for a little while. She was playing her role in the game, trying to slow roll things, not give the calendars committee enough time. She couldn't pass it out quickly because then the calendars committee would have had to sit on it forever. So she had to wait, and then pass it out. It's a hot potato. These bills are hot potatoes. And you have to understand, if you are a chairman that plays ball with leadership, you have to hold the hot potato. And they try to let you hold it just long enough before it's like really burning your hands. And then you hand it to the next guy. And then he sits on it a while. And if you run the clock correctly, you can kill all this policy. Senate Bill 177 got placed on the last calendar. Oh, sorry guys, just couldn't get to it. And they think they're cute by passing him out of the calendars committee. That way all the Republican members of calendars can say, what are you talking about? I passed that bill. And you go to Stephanie Klick and she goes, I don't know what these people are talking about. I passed 2 bills that dealt with that issue. The question is, why is it not law? Why has the governor not signed the bill? You want to know why? Because y'all are not incompetent. You're actually smart enough to know what you're doing. And you killed Senate Bill 177. Stephanie Klick, Dustin Burrows. Senate Bill 2086, DNA ownership by Lois Kolkhorst. You know what? Do you think you own your DNA? I think you own your DNA. They don't think you own your DNA. Lois Kolkhorst in the Texas Senate passed a bill that was pretty simple. Said, you own your DNA. It went to a Democrat-chaired committee. We tell you, don't have Democrat chairman. A lot of these bills were killed by Republican chairmen. I heard from one person who was at a town hall with one of their state representatives last week, and they asked about Democrat chairs. And one of the things he said was, I want to be clear, none of the Republican priorities died in Democrat committees. And so everybody in the room was like, oh, well, that sounds pretty good. And they're like, hey, this is what he's telling me. I said, yeah, what he's not telling you is they all died in Republican committees. And isn't that crazy? This is how much the Texas House will gaslight you. Like, well, look, the Democrats didn't kill it, so we can give them all these committees. We killed it all. But you should be happy with me that I didn't let the Democrats kill it and we killed it instead. This bill, though, died in a Democrat-chaired committee. Senate Bill 265 by Charles Perry. This is the state reporting for vaccine injuries. Let me just remind everybody, there's no debate about whether children get injured with vaccines. There's a debate about how many children get injured with vaccines, but not whether they get injured in vaccines. The federal government has a program specifically to pay out because they have all these mandates and then say, look, well, some of the kids are going to be collateral damage. And if they get brain injuries or other injuries, we're just going to have to pay their parents some money. This bill just said, hey, if you're a doctor in Texas, like you have to report those injuries to the VAERS system, which would make it much easier for parents to also work their way through this compensation process. The Senate passed the bill on April 20th. Never even got a hearing in the Texas House. Stephanie Klick, chair of public health, killed the bill. If you're wondering, well, when you say didn't even get a hearing, what do you need to do to get a hearing? The chairman of the committee has to set it for a hearing. Well, is there any way for anybody else to set it for a hearing? Nope. The chairman of the committee sets it for a hearing. So when I tell you this bill never got a hearing, that is literally the chairman of that committee saying, I don't even want people to hear about this bill, let alone vote to pass it out. Senate Bill 1584 by Bob Hall was the blood donation protection bill. Let me just quickly explain this problem that exists. Okay. Certain people say, hey, I want blood from this guy. This guy and I share the same blood type. I would like him to be able to donate blood and that blood be given to me. And he says, I want to donate blood and give it to that guy who needs blood and knows me. But what's happening is some people would like to have somebody donate blood to them that's not vaccinated. And the medical mafia is like, no, you can't do it. So Bob Hall files a bill, Senate Bill 1584, to address this issue and passes the Texas House. The calendars committee kills it. Put it on the very last calendar. Oh, sorry, we just didn't get to it. Senate Bill 666 by Bob Hall, Medical Board Reform. The Texas Medical Board is a weaponized agency being used to target conservative doctors. They can lose their license based on an anonymous complaint. So you have some doctor who's treating patients, let's say for COVID, and they're saving people's lives. And the leftist medical establishment goes, we need to report that person to the Texas Medical Board. And they do. They're not a patient of that doctor. They've not even worked with that doctor. They never need to say. This bill would have reformed that process. Passed the Senate on May 12th. Never even received a hearing. The Public Health Committee, Chairman Stephanie Click, killed the bill. Senate Bill 389 was the Medical Board Transparency Act. So right now, the Texas Medical Board is not giving legislators legislative requests. They're not responding to legislative requests. And they're using these little loopholes that they've interpreted in state law to say, we don't really have to give you any of the things you ask for. So if you as a legislator ask the Comptroller's office, the Workforce Commission office, some other office, hey, we want some information from your agency, they have to respond. But if we ask the Texas Medical Board, Medical Board says, we got this kind of way of working around it. So Bob Hall files a bill and says, no, you're going to have to be more transparent. We're going to take a dark leftist state agency and bring it into the light. Passed the Senate on May 3rd. Never received a hearing. Went to the State Affairs Committee. Todd Hunter killed the bill. Senate Bill 301 by Bob Hall was the right to treat. This bill prohibited licensing boards from denying, revoking, or suspending a license or taking any disciplinary action against a licensed certified healthcare provider or pharmacist due to lawful dispensing, prescribing, or administration of ivermectin or hydroxychloroquine. Very simple. These are two drugs the medical community loved until people started saying, hey, we're going to use it as one of the treatments for COVID, one of many. And they said, no, that is not what we've all agreed upon. Even if our treatments are not as effective, you're not allowed to do it. And we have doctors in Texas who are being punished with your taxpayer dollars, and agencies are coming after them. The Texas Medical Board. This bill passed the Senate on April 20th. Never even got a hearing. Stephanie Click killed it. Went to the Public Health Committee. Senate Bill 426 by Angela Paxton was the right to treat as well. I call it kind of right to treat number 2. And basically this bill allowed patients the right to access off-label medication if their doctor prescribed it for COVID. It was basically saying, hey, when it comes to this disease that shows up, we're not going to basically come in and tell doctors you're only allowed to prescribe these few drugs. We're going to say, if there's anything you want to prescribe to your patient who has entrusted themselves to your care, you can do it. No adverse action taken against you. It passed the Senate on April 5th. There's tons of time. That's like passing in halftime in the Texas House. For the third and fourth quarter, Stephanie Click killed it. Never even got a hearing in the Texas House. Senate Bill 426.